that have come out in the metro over the past few months is that 8,000 contract workers, their contract is going to lapse at the end of this month, and there are concerns that as we head towards a third wave and contracts are lapsing, will we have enough staff to deal with this new surge? Well, joining me this afternoon is the MEC of Health, Nomakhosazana, Meth, to talk more about this issue. MEC, let's just first talk about the 8,000 contract healthcare contracts that are coming to an end at the end of this month. There have been concerns that there will be a third wave. So if these contracts do lapse, does not that put us in a compromising position in our health sector?
To you, Lerato, and your viewers at home. We know that when we appointed these contract workers, it was after the declaration of the disaster and the special adjustment that was made to make us to be able to appoint more than 8,000 contract workers. And this financial year, there's been no allocation to that. But as a department, determined to make sure that we are ready, in particular with the human resource capacity to deal with the possibility of the third wave, and also to continue rolling out the vaccination. We have since taken a decision as a department that at least the 5,400 EPWP category of the contract workers shall be extended with a year. And again, the other category of nurses, doctors, and all other healthcare workers that have been contacted by the department, we are looking at extending with three months. Then we'll look as we go into the year what goes on. But we are assuring our people that we can't afford to get to the winter and to this threat of a third wave without us being ready with the human resource capacity. Hence, we are saying we'll be doing that extension.
Another issue has been the issue of financial struggles that the department is facing. Obviously, to employ more workers, more contract workers needs more money. Do we have the right financial stability and enough funds to take these workers on as we go to a possible third wave?
Yes, we've got financial challenges as a department, but we continue to prioritize to make sure that we have the critical post filled, and as such we are using our PCCC, which is a provincial cost containment committee, to prioritize and ensure that there is stability in the human resource areas of our department, but also want to work with what we have to look at what is it that you find at the head office in terms of rationalizing our human resources so that we can be able to deploy the prerequisite skills to where they are needed most. For an example, the issue of acting capacities in the hospitals of CEOs is a matter that will be moving with speed now that we have dealt with the strategic plan and the policy speech delivery. We'll be now putting our hands on the deck to ensure that at least 3 critical posts in all our facilities are filled, and we'll be using also what we have. As I'm saying, we'll be looking at the capacity at the head office and the district level to see who can assist where to ensure that our facilities are well empowered to deliver the services to our people.
So you're saying that by the end of this month, those whose contractors were lapsing will get their jobs back. There will be no person without a contract by the end of this month?
Yes, I'm saying that.
Then also in terms of the vaccine rollout, there has been some criticism that the Eastern Cape is perhaps lagging behind in terms of the vaccine rollout, especially in terms of health workers. The target for the department is 200,000 health workers by the end of May. Are you now confident, perhaps also with the boost from the Aspen manufacturing site, that we will meet the 200,000 target of health workers by the end of May?
Actually, the point is that there was an issue with the availability of the vaccine. Now with this facility promising and committing to offer us more doses, I'm confident that we are ready to move with speed to roll out the vaccination, because it was not a matter of us not having a capacity, but it was a matter of the availability of the vaccine itself. Hence, we've received about 29,000, and already we were able to inoculate more than 23,000 people, the human resource of our health department. So I am confident once the vaccine is available, we will be able to meet the target, which we are targeting at least before the end of May, or by mid-May. We must have finished the first phase, which is the 200,000 healthcare workers who are the frontliners.
And last, MEC, we are going towards the very busy Easter season, where a lot of people will be coming into our province, coming to have Easter celebrations here. Just your message to people as they obviously celebrate, and also just to perhaps your concern, especially because Eastern Cape does become a target when people come from other provinces to our province.
Yes, we are pleading with our people now that we are going to the Easter weekend to remain vigilant, because even though we are very comfortable by the fact that the Eastern Cape is still the least in terms of the numbers on new infections in the whole country, but with the weekend coming and knowing that our province is having many people working in other provinces, we are saying our people must remain vigilant, because COVID-19 is still with us and there's this threat of the third wave. If then we act irresponsible, we may even bring that date for the third wave closer. So we are saying to our people, as we know that there will be social gatherings, family gatherings and churches, they must please continue with the non-pharmaceutical protocols to observe this social distance, to wash their hands, to put masks and ensure that you don't go away from home for no reason. You must also go when it is compulsory to go out, because it is only if we do that that we'll be able to avert the situation of the third wave.
Well, that was the MEC of Health, MEC Meth, just saying that she's cautioning all people as we go towards the very busy Easter season that as much as people want to celebrate with their loved ones, they must do this by complying to COVID-19 regulations. Also really hamping in on the issue of the contract workers whose contract healthcare workers, COVID-19 contract healthcare workers whose contract actually expires end of this month. She was saying that she's confident and she's assuring them that by end of this month, no COVID-19 healthcare worker who was on a contract will lose their job, saying that there are plans in place both financially and logistically to make sure that everyone who was working under COVID-19 as a contract worker will have their job come end of this month and going forward. Also saying that come the third wave, if it is going to come, they will make sure they've got enough health workers, both volunteers and also contract workers in place to fight should this third wave come. But for now, let's go back to you in studio.